So, Laurie, tell me, how many young children are homeless in Boston or in Massachusetts?
Well, the numbers vary. It's unfortunately a very difficult category because some children go through the shelter systems, some are going from family member to family member, some are in cars. The estimates right now are about 100,000 children in Massachusetts will face homelessness over the course of a year. But again, it's a really hard number nationwide to track because it's a very nomadic, if you will, group. Just so it's very, the census has a very hard time tracking it too. So, but those are pretty accurate estimates, I think, from the other services that the kids are receiving. And it's easier to find at school age because then kids are mandated to go to school. So of course they're, between different feed programs and things like that, there are different ways to calculate it, but that's the estimate.
So is counting homelessness itself an issue or a challenge?
Yes.
Trying to document it and figure out what it means, whether or not the homeless are homeless for a night or for a month or for a year, or if it's persistent homelessness. Are any of those questions really important?
I think they are very important because I think there are so many issues and so many in terms of the needs that these children have, whether it's medical care, nutrition, certainly early intervention, and
mental health care.
Oh yeah, there's so many different factors, and
substance abuse.
We have a lot of research about different symptoms that homeless children will have more prevalently than children who are living in poverty or even below the poverty line. But they're 4 times more likely to have asthma, 10 times more likely to have dental issues, chronic disease, if kids aren't treated early, just become lifelong issues. So certainly, I think just as any good educational program looks to have intervention, early intervention, I think we look at that very holistically. How can we provide early intervention in these other areas? And I think that certainly in terms of brain development, which we have the expert on that, he'll be speaking on the second, just nutrition, basic nutrition, it has a huge impact on brain development. And what's interesting, I think, in so many research areas, we look for studies, 5 years, 10 years from now. I think here the impact of feeding a 2-year-old, for example, who hasn't been exposed to proper nutrition is pretty immediate. You can see that in terms of their health is affected, within weeks or a month. Ear infections go way down. There are all kinds of things.
Tooth decay.
Oh yeah, and it's pretty quick impact, and it's something that really I think is long term. I think you're placing the odds against chronic illnesses, by having that early intervention.
No
so
question.
It's I think those are all very important questions and issues to address.
So we're going to be talking about those issues November 2nd. So our inaugural speaker is Jack Shonkoff. He's at Harvard now, used to be at Brandeis. But Jack was the editor of a very important work, From Neurons to Neighborhoods, more than a decade old now. But it was, for most of us, the first set of literature that raised the proposition that yes, homelessness is a problem, trauma is a problem, poverty is a problem, but we're learning more about the ways in which some of that can be, if not lost forever, kids can recover from this start in their lives. And so I think it's going to be really interesting to ask what we've learned over the course of the last decade about the capacity of any theories or interventions to really help students, help young people, toddlers, infants recover from homelessness, the trauma associated with it, the disease associated with it, and that sort of thing. So I know that everybody knows that Jack Shonkoff is a wonderful advocate of children, of families in poverty and in hunger. But is one of your goals to really examine the intersection between neuroscience and child homelessness and trauma? Is that something that's important to you?
Oh, it's hugely important. And I guess the good news is as technology advances, the ways of mapping brain development and also understanding it has, even in the last decade, changed so much. I think that, when I was at school here, not that long ago, but we had a much different understanding of brain development. And, it was pretty much thought that you had, this birth to 5 burst, and then things shut down and you had a little relapse in, your adolescent years, and then good luck to you. You better use what you have. And I think now we're really getting much better at mapping the brain and understanding not only how we can impact development and positive brain growth and all the developmental pieces that go with that, but I think the other piece, which is another piece that I'm hugely interested in, is also the impact of trauma and how we can remap the brain after traumatic events. Exactly. And that's very new information. I think that's something that people didn't talk about, and many of these kids have witnessed traumatic events, and are, whether you categorize it as post-traumatic stress disorder or however you want to, whatever umbrella you want to put it on, it's a real issue for these kids. And I'm so hopeful as we progress with our understanding of brain development and also the ways to treat trauma, that there really is a way to have a long-term impact on changing what these kids have lived through, and really having the ability to just open up the possibilities for them to learn and just to become healthy, self-sufficient members of society. And I think that we used to think it was much harder to get there, but I think we're understanding now that the brain is a pretty amazing tool that we all have, and that it's a little more malleable than we ever thought it was. So
absolutely.
That's very positive.
Absolutely. So as you were talking, I was thinking about our students listening to this conversation on November 2nd, asking what can be rewired, what can be recovered, what can be minimized in terms of trauma, and maybe having them think for the first time about careers that actually would take them to a classroom, yes, as a teacher, but might also take them to a public health school or some other facility to marry childhood education and neuroscience. I think that would be so helpful for them as future teachers. And I'm also thinking now about Nancy Carlson Page and the work that she has done and is doing with respect to the quality of play for children who are vulnerable, and the intersection between how we somehow manage to get our arms around and embrace homeless children while at the same time giving them more of a human capacity to succeed, and having us rethink then what it means to be effective parents in vulnerable situations. Sometimes I know when children are homeless, they are actually separated from their mothers and fathers if they have mothers and fathers. But it seems to me this child homelessness and family vulnerability, that these two things are linked. And so I suspect during the day on November 2nd, we'll hear both conversations about advancements in neuroscience and the ways in which we have to try to structure our federal and state policies to ensure that families that can function do function well despite their vulnerabilities. So I think that's going to be a real challenge.
Yeah. Well, I think the policy issue is something that always comes up. And to me, one of, I guess, a dream I would have for many homeless children is just access to daycare and preschool. And sometimes when I say that, people are thinking, oh, is she talking about pre-reading and things like that? But and it's even much more, I think, rooted in the idea of play. I think it's in the idea of giving parents an opportunity to be the adults they deserve to be, and giving children the opportunity to be the children they deserve to be. And I think having that a safe place to go, and to, whether it's to crawl into somebody's lap and be read to, which a lot of these parents can't do because they're thinking, where are they getting their next meal? Where are they sleeping that night? It's really hard to get to the nurturing part where you're doing crisis intervention, which is what these families are doing every day. So having these kids miss out on that is at a huge cost to them and their development. And so having safe places where these kids can go and play with Play-Doh, or do imaginary play, you know, whether it's with puppets or just make-believe or trying to understand. It helps them, A, tell their story. It helps them hope, I think, that the mind is a very powerful tool of hope, that giving kids that opportunity just becomes so invaluable to them and their development. And it also gives the parents an opportunity to go take care of what they want to take care of, which is really to become good parents, good providers, and to become self-sufficient. So, yeah, lots of good conversations to come.
So in the audience that day, I think we'll have some local and state officials. We'll have some people from foundations and agencies who every day of their lives they're trying to figure out what they can really do as an intervention that will make a difference in the lives of young children and their families. So if there's one message to that group of people whose collective responsibility it is, along with our federal and state policymakers, to try to move us to a different place in terms of homelessness, what might that message be?
I think for me, probably the message of collaboration, that we don't each need to individually recreate the wheel, that there are so many great programs that exist that where people are doing things beautifully, where they know how to feed these children or get them the health care that they need or the access to child care and to education. And I think focusing that piece on the children's well-being, you can't do that without thinking about the parents' well-being. So I think we have to look at it holistically. But I think thinking about sitting around a table and everybody facing inward and thinking about what we can do together, I think sometimes we find that we're all sitting at the table, but we're all looking out for what we're going to do. And I think if we put our collective resources and energy and our ideas, and most of all our hope, into a big pot in the middle and we stir it up, I think what we can do is going to be tremendous. And these kids will benefit from it. Our society will benefit from it. And it's our legacy. It's what we're meant to do. We should take care of our children and do it well. No
question, no question. So one of the sessions we're having actually is on interagency collaboration. But also you've made so clear that there must be some sort of civil society collaboration as well, because it will take all of the players listening to each other, trying to understand best practices, and actually looking around not just this country but the world at what is working and what isn't. There must be a reason why some countries in the world have greater rates of homelessness among children than others. So I think there's quite a bit that we will learn from that day in terms of listening to and asking questions about what actually has worked and has not worked.
Yeah. I think there are lots of good examples. We know we can see what isn't working, and I think it's important to talk about that, but I think it's much more important to look at what is working and take these models and enlarge them and give more children access and figure out how to become a bridge to those programs. And I think that the conversation is the best place to start.
I agree. So that day we're going to end with a new generation of leaders and teachers and policymakers. I think they will take so much from that day, but the one thing they'll take is the responsibility that they have to make the lives of vulnerable children much stronger and much better. So thanks so much, Laurie, for your contribution to this conversation and to a wonderful collaboration.
Well, I picked a great partner, so thank you. Thank you.
Very welcome.